Hi everyone. Few common questions which I come across from varicocele patients. Doctor, I just underwent physical or medical examination while joining some course. I got to know that I have varicocele. I don't have any other symptoms. Is treatment required? Is varicocele associated with infertility? What should I opt for? Whether embolization or surgery? What are the future consequences if I undergo embolization of the gonadal vein or testicular vein? So let us see everything about varicocele today. I am Dr. Vineeth, Interventional Radiologist, Narayana Hospital, Bengaluru. To begin with, varicocele is a common condition seen in approximately 15 to 20% of male population. It refers to abnormal dilatation of the veins which are present around the testis. That means the veins which carry blood from testis towards heart get dilated because of either reversal of flow or stagnation of the blood. So what are the causes? First one, failure of anti-reflux valves. The testicular veins join the renal vein on the left side and IVC on the right side. These veins have valves which allow flow in only one direction, that is from testis towards heart. Any failure of these valves will allow retrograde flow, that is from heart towards testis, which is not normal. This leads to stagnation of blood and abnormal dilatation of the veins. Second, nutcracker phenomenon. The artery which supplies the intestines forms a narrow angle with the aorta where it compresses the left renal vein, leading to increased pressure in the left renal vein and increased pressure in the gonadal vein, which leads to reversal of the flow. Third thing, lifestyle disorders like lifting heavy weights without proper abdominal or scrotal support, smoking, stress, nutritional deficiencies. Also in case of certain kidney tumors or retroperitoneal tumors, we see unilateral varicoceles. So who requires treatment? If you don't have any symptoms pertaining to varicocele, you don't have any infertility issues, then there is no need for any procedures to treat varicocele. You can use micronutrient supplements and scrotal support to prevent future progression. On the other hand, if you have dull aching pain or scrotal heaviness which increases after standing, walking or traveling for long distances and is decreased by taking rest, then you need to consider some procedures for treating varicocele. Yes, varicocele is associated with infertility and is seen in approximately 40% of infertile men. Also, varicocele can cause decrease in the size of testis in approximately 10% of infertile men. Production of sperms requires lower temperature, and that's the main reason why testes are kept outside the abdominal cavity. So dilated veins and stagnation of blood will increase the temperature and cause impaired production of sperms and impaired storage. So any adolescent who has varicocele has to be treated to prevent future infertility. What are the treatment options? In older days, surgeon used to insert laparoscope to gain access into the retroperitoneum, find the abnormal venous channel and ligate it. It is rarely done now and only in few specific situations. Microsurgery either by subinguinal or infrainguinal approach. So in this, a surgeon puts a incision over the lower groin or the upper scrotum, find the faulty veins, ligate and remove them. So this procedure requires general anesthesia, leaves a scar over the region and has quite a prolonged recovery time. Also, there is a chance of recurrence because few tiny veins which are missed out during this procedure. On the other hand, the varicocele embolization, in which we gain access into one of the veins in the neck, use catheter and fluoroscopy to navigate all the way down into the scrotum to find faulty veins, do venography and put a chemical called STS, sodium tetradecyl sulfate, in 1:3 ratio mixed with air to create controlled inflammation which causes closure of the faulty veins. Also, from formation of pampiniform plexus up till the junction with the renal vein on the left side and IVC on the right side, we embolize the entire vein using medical grade glue So what are the advantages? Varicocele embolization leaves no scar, there is no requirement of general anesthesia, it's a daycare procedure and has very low complication rate. So what are the outcomes? If you consider microsurgery, the recurrence rate in microsurgery was around 1 to 3%. But when compared to varicocele embolization, in older days, the embolizing agent used was coils. That is, coils were placed right from the formation of gonadal vein from pampaniform plexus up till junction with renal vein or IVC to block the entire gonadal vein. But nowadays we have switched from coils to STS chemical and medical grade glue. So the recurrences which were higher previously, let's say around 10%, have now decreased significantly, merely 2 to 3%. That is as same as microsurgical recurrences. Also, in case of any recurrence of varicocele after microsurgery has been done, then again we can go ahead with varicocele embolization. So what to do after varicocele embolization? There is no restriction on routine activities. You can start your routine activities from the next day itself. You can go to office, travel, have food and do light exercises. Avoid doing heavy exercises for at least 30 days after varicocele embolization and use scrotal support when lifting heavy weight during a period of at least 30 days. And if the varicocele embolization is done for infertility purpose, then an interval of at least 90 days should be considered before undergoing next sperm analysis. That is, sperm production takes roughly around 60 to 90 days to get replenished, and this is the interval that is needed to undergo repeat sperm analysis once you undergo varicocele embolization. I request everyone to consider different choices, take second opinions and make an informed decision, make an informed choice whether to undergo varicocele embolization or microsurgery. Follow and subscribe to know more, or if you have these symptoms or if you know who has these symptoms, please refer to nearest interventional radiologist. Thank you.